Some social media doctors say you should pull out your root canal treated teeth. Teeth that are working just fine because they're causing diseases in other organs. If a dead tooth really could harm you, that's something everyone deserves to know. Hi, I'm LÍGIA, a dentist with over 15 years of clinical experience, and today I'm going to show you 6 viral claims so you can find out which ones are true and which can put both your health and your teeth at risk. So if you're worried the root canal can make you sick, this video might save you from making a decision you'll deeply regret. Claim 1. Dead tissue inside the canals attracts bacteria.
What this does is leads an area that is very susceptible to infection. That dead tissue always attracts bugs.
You've just heard that if dead tissue is left inside the canal, it attracts bacteria like a magnet. That sounds dramatic, but it's not how biology works. Inside every tooth, there's a maze of microscopic canals and side branches. No instrument can reach every tiny spot. That's why we use disinfectants. They dissolve leftover tissue and kill bacteria, even in areas our tools can't touch. It's true that after cleaning, a few microscopic bits of tissue or bacteria might remain, but that doesn't mean infection. What matters is whether the bacteria stay active and whether the canal is properly sealed. Root canals are a delicate procedure that requires precision and experience. And honestly, that's where the bad reputation comes from. When it's not done well, people end up blaming the treatment instead of the poor work behind it. So the idea that dead teeth attract or absorb bacteria, just not true. Bacteria don't get attracted. If the canal's well done, old bacteria can survive and new ones can't get in. And without bacteria, there's no infection. Claim 2. Dead teeth can make you sick.
So a lot of times the infection spreads throughout your body. It's going to affect your overall health. And
this is the big one, that root canal treated teeth or dead teeth are toxic and leak bacteria into your bloodstream, causing disease in other organs. Scary idea, but science says otherwise. The truth is, untreated tooth infections can be dangerous. They can spread to the jaw and the face in the form of an abscess or even into the bloodstream. But this spread is linked to untreated infection, and it happens only in very specific situations. It is much more likely in people with weakened immune systems, such as those with uncontrolled diabetes, people on corticosteroids, transplant patients, or those undergoing chemotherapy. In healthy people, it's uncommon, and it's usually linked to severe and neglected infections that have been there for a long time. That is why root canal therapy exists, to stop that infection. This myth comes from the early 1900s, when doctors believed in the focal infection theory. They thought any once infected tooth could still make you sick. But modern research completely disproved it. Today, we know the opposite is true. When a root canal is done properly, inflammation in your body actually goes down. It has been shown time and again. By removing a source of chronic infection, root canals help reduce inflammation. We can see it in blood markers that rise during infection and then decrease after successful treatment. And major health organizations, like the American Heart Association, confirm there is no scientific evidence that root canal treated teeth cause systemic disease. Claim 3. All infected teeth need to be removed.
so once a tooth is infected, it's already dead and it already has bacteria growing there, the option of choice is going to be to remove and replace that tooth. Now,
That is concerning advice. Extraction can be a valid choice in certain cases, but it should never be the first option out of fear or misinformation. Saying the only way to treat an infected tooth is to pull it out leaves you without a tooth and without options. An implant is a replacement, not a treatment. There's simply no prosthetic that can outperform a treated natural tooth. And every replacement, no matter how advanced, comes with its own risks. A root canal, on the other hand, is a treatment, and it's designed to eliminate infection and keep the tooth. Extractions and implants are still options if we ever need them later. But if you want to treat and keep the tooth, root canals are the way to go. Claim 4. All live teeth can be saved with ozone.
of course, if it's still alive, we have a great shot of saving it. We do what I just explained to you. We remove the cavity down to the deepest part, don't expose the nerve, ozone it, fill over top of it, and rebuild the tooth.
So here the claim is that any affected tooth can be saved with ozone. That's simply not true. Yes, the tooth might still be alive, but that doesn't mean it's healthy or capable of healing on its own. Tooth inflammation actually falls into two types, reversible and irreversible. In both, the tooth is still alive, and both can hurt and cause sensitivity to hot or cold. So how do we tell them apart? We do it through clinical exams and pulp vitality tests. Reversible inflammation can heal, meaning the nerve is affected, but it can return to a healthy state. And this is where vital pulp therapies, the so-called nerve-saving treatments, work beautifully. This is something traditional dentistry has been doing for decades. We don't use ozone, we use materials that science has proven to work: calcium hydroxide, MTA, or biodentine. These materials fight bacteria and repair dentin, so the pulp can heal. But once inflammation is irreversible, there's no amount of ozone or laser that can fix it. At that point, the only reliable treatment is a root canal. Saying every sensitive tooth can be healed with ozone, or that ozone can replace root canals, just isn't true. It ignores biology and diagnosis. It might sound nice on YouTube, but it's not how real dentistry works. Claim 5. Root canal treated teeth don't have warning systems.
As the nerve is gone, you can't feel it. Your early warning system about these problems is actually missing. So
it's true that after a root canal, the pulp containing nerves and blood vessels is gone. So the tooth itself no longer has an internal immune response. But that doesn't mean it's defenseless. The bone, ligament, and gums around it are very much alive, with full immune activity. Saying a root canal treated tooth has no defenses is like saying a house is unprotected because the lights are off inside, forgetting it still has fences, alarms, and cameras. That's how healing happens. Those living tissues clear out any remaining bacteria and repair the area around the root tip. We can actually see the infection healing and the bone growing back, filling in the areas that were previously infected. Even fistulas, those little draining abscesses, disappear completely and the tissue fully regenerates after a successful root canal. Actually, long-term studies, some following patients for over 10 years, consistently show success rates between 85 and 97%. That means the tooth stays infection-free and functional for many years, often for life. And that's not opinion, that's clinical evidence. Claim 6. Onlays are a revolutionary alternative to crowns.
rather than taking off tooth all the way around and all the way across the top to put a crown over the whole thing, we just clean up and shape the parts that are already missing. Because
another trendy claim is that onlays are a revolutionary alternative to crowns, when in fact onlays have been part of traditional dentistry for decades. In simple terms, onlays cover part of a tooth, reinforcing what's left, which works when there's enough structure. Crowns cover the whole tooth, and they're necessary when there's too much damage. So no, onlays don't make crowns obsolete. Neither is better or worse, they're just different solutions for different cases. The truth is, a root canal isn't just about avoiding pain. It's about keeping a part of your body that nature designed perfectly, your tooth. When we treat and protect it the right way, your own biology does the rest. Modern dentistry, based on real science and decades of proven success, remains the safest and most reliable way to protect your teeth and your health. So don't let fear guide your choices. Ask questions, trust evidence, and choose treatments that are proven to work. Your teeth and your body will thank you. If this video helped you, subscribe for more, and I'll see you on the next one for another fresh take on every bite. See ya!